Welcome back. In today's video, we're going to talk about some differences between provider test action, communications, and inbox clinical tasking. So the first thing is that a provider test action and communication, both of those are templates. So that means that whatever's documented in either one of these will become a formal note within a patient's medical chart. Whereas with inbox clinical tasking, it's a non-template, so whatever task gets sent back and forth between a doctor and a coordinator, for example, will not be added as formal notes within a patient's medical chart. So this is the summary. Just to kind of show you, we can view an example here of the test patient con and this communication that was sent to me. So I notice here that this communication was sent from Donna. I have an option now to reply using my clinical tasking, and I can just hit reply and type in my response and send it back. And we know that that did not become a formal communication within the patient's chart. That was something just between Donna and I. Now, if we would have entered the patient's chart and then notice the communication screen, in order to respond to this communication, I had pulled up a communication template, pick the relevant title, and then document in my response, and then would have scrolled down and hit preview document to make it a formal communication note that anyone can refer to when trying to view this patient's medical chart. That same concept also applies to the provider test action screen. However, a difference between documenting a response to a provider test action versus communication is that in order to respond, you'd have to hit edit, and then within clarification questions response is where I would type out my task, click add, save and close, and then I would formally see my name, date and time along with my comment to this provider test action that was sent to my inbox. Another difference between provider test actions and templates is that I won't be able to see who this was tasked to unless the person it was tasked to came in here and formally documented the response. Whereas with a communication, if I go into the template and then toggle over, it will tell you who sent the communication, who it was tasked to, and then you would see from later entries that if it was responded to or not. And that's kind of a subtle difference between communications and provider test actions and seeing whether or not they were tasked to someone. With communications, it's readily available by toggling to the right side. With provider test actions, you're really just relying on the person to click within the task and click edit, come in here to document their response, and then you would see their name appear. And just as a reminder, with clinical tasking, you can always see who it's been sent to and from, and you always have the option to reply just from your clinical tasking box. And once again, thank you very much for your time.